This is Personally Fit in Dayton, Ohio, and we use the functional movement screening with most of our clients to help them move better and move more. The first assessment is the deep squat. This shows us a coordinated extremity mobility and pelvic and core stability, postural control with the hips and the shoulders, symmetrical positions, and symmetrical mobility and stability of the shoulders, the scapular regions, and the thoracic spine. It challenges the total body mechanics and neuromuscular control. The hurdle step begins with a measurement of the subject's tibia, and then we set a band to that height. What we're looking for and evaluating during this assessment is your step and stride mechanics, your ability to have stability and control when you're in a single leg stance, and also bilateral mobility and stability of the hips, knees, and ankles. Also, the stability of the hips and the core. The movement, as you can see, is lifting your knee up, stepping over a band, and then placing your heel or your toe on the opposite side and then returning it. And we're looking at all parts of your body from your shoulders to your ankles. The next assessment is the inline lunge, and it uses the same measurement of the tibia for the stride length. So you will put your heel at the length of the tibia and the other foot is at a 0, and you do a static lunge down with the one knee touching behind the other foot. We're looking for spine stabilization, hip, knee, and ankle and foot mobility and stability, and also flexibility of the latissimus dorsi and rectus femoris. We're looking at the whole movement pattern. Can your ankles, knees, hips, shoulders, how are they moving? And also for, again, asymmetry between the left and right sides. Next is shoulder mobility, and it requires scapular stability and thoracic mobility. And we're looking at bilateral shoulder range of motion, extension, internal rotation, and adduction in one extremity, and flexion, external rotation, and abduction in the other. And we're looking for asymmetry between one side versus the other. And that also can indicate when you're at risk for injury in the shoulders. We then perform a shoulder impingement clearing exam because it can't always be detected in the shoulder mobility assessment. So we do a separate test for that. The active straight leg raise assessment shows us if you have active mobility of a flexed hip, also pelvis and core stability within the pattern, and also hip extension of the opposite hip. So we're looking for any limitations of flexion or extension, and then that shows us where you need to be stretched or strengthened. The trunk stability push-up is not an upper body strength assessment, but a reflex of core stabilization. Can you stabilize the spine and perform a symmetrical pushing movement? Then we look to see if you have any pain with a spinal extension clearing test. In the rotary stability movement pattern, we're looking for multi-plane pelvis, core, and shoulder girdle stability during a combined upper and lower extremity movement. So do you have reflex stabilization of the core and trunk? Scapular and hip stability. Also knee, hip, spine, and shoulder mobility. Then we just want to make sure that during spinal flexion you don't have any pain. Here at Personally Fit, we use the functional movement screening to assess your personal movement patterns. Then we can give correctives to help you move better and have clean movement patterns that then we can weight with extra resistance and know that you won't be injured.